So it depends on the problem you're coming with. I mean, some of us have training to do internal pelvic floor work, so working on soft tissue and trying to assess muscle function, strength, or spasticity within it. I mean, some of it might be as simple as watching you do whatever functional task you've been having difficulty with and trying to assess the mechanics with it to see if there are other areas that aren't functioning well. We might do some retraining work. So I mentioned bladder diary, different discussions on just getting your mind more aware of what's going on, discussing the just in case peeing and how that can be problematic, and just trying to get the whole body to function together. So that way these areas don't become a problem in the future.
And then it's probably important to note that even though we talk about, doing an internal exam, very rarely would we ever do that, even on the very first visit, because we're trying to get to know the person as a whole and how their whole body is moving. And then, if it's appropriate, then we will try to assess with an internal exam, and it's not the focus. That's just a part of how we treat the person as a whole. And it helps give us some more insight as to what they're experiencing.
Mm-hmm.
And then usually the person's goal is not just to be able to, stop leaking, but it's just like to be able to return to a functional lifestyle, without some of these issues. And I think that's achievable. Mm-hmm. And I think because there's more awareness, I think more and more people are going to seek that type of therapy.